Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video. And here we have a patient who attended with bilateral dead skin plugs, and you may notice by all these bubbles that are present in this ear. This patient has been using hydrogen peroxide urea drops, also known as carbamide peroxide, and that creates this bubbling effect. It's effervescence due to the reaction of hydrogen peroxide with an enzyme called peroxidase, which is secreted by the ceremonous glands, and it converts hydrogen peroxide into water and oxygen, and we get this bubbling. And this bubbling is believed to help fragment the wax plug. The problem with hydrogen peroxide based drops is that, especially ones that contain urea like this, it can turn the wax or keratin plug into a horrible mushy consistency, and you're going to see that on this patient's eardrum in a moment. In addition, it has a bleaching effect. Hydrogen peroxide kills and destroys atoms called chromopores, and one of the chromopores in skin is, and obviously this is a keratin plug, it's melanin. And melanin absorbs...
He said straight away, I know exactly where we should go.
It's always good when people can recommend.
With colour.
Yes.
And hydrogen peroxide kills chromopores, so the wax and dead skin, it loses its colour and it almost camouflages itself against the canal wall and the eardrum, so it makes it 10 times more difficult to remove. Now, we can see the patient's eardrum, but you can see we've got all this mushy debris on their eardrum, so I'm just zooming in now. I'm going to remove some of this off this patient's eardrum, but yeah, it's very hard to distinguish sometimes this mushy wax from the canal wall and the eardrum. So just using the fine end suction probe here, we're just directly on the eardrum. Just take away some of this. Also, hydrogen peroxide based drops, because of this effervescence effect, this mechanical bubbling, which is designed to help fragment the skin plug, but you've got to remember that the ear canal itself is lined with skin. So not only is the hydrogen peroxide going to fragment the skin plug, it's also going to start to fragment the epithelial skin cells that line the ear canal. So you can see this canal wall, it's got all this dead fragmented skin on the surface, and whenever I see stuff like this, I just like peeling away the outer layer just to make sure there's nothing untowards underneath. For example, a canal cholesteatoma. If you've been watching my videos of late, you'll notice that what may appear quite innocuous, like a thick blanket of skin, underneath that, I've discovered a few canal cholesteatomas recently. I've got one more to upload actually, and I will try and do that maybe tomorrow or early next week. So this is where the WAXscope has significant benefits over head loops, which is what's most commonly used in the UK to remove earwax. It's the magnification. I would never dream to do this with the head loops, and I've got some pretty decent ones as well. It also does provide more magnification than an endoscope, but the endoscope just provides an unparalleled field of view, so again, they've got their pros and cons. But an endoscope is a bit more difficult to use for specialists, hence why I developed the WAXscope as an alternative if someone does struggle. You can just see the base of this ear canal, it's all this skin, it's kind of macerated, it's broken up. Just to be on the safe side, I'm just going to peel away this fragmented skin just to see what's underneath. Unfortunately, everything was fine. I did have a courtesy look with an endoscope afterwards as well, just to make sure everything was okay. So this is at the floor of the ear canal. So unlike an endoscope where you see the whole ear canal because of the field of view, it's not the way the WAXscope works. It works like an ENT microscope. You're getting magnification. The greater the magnification, you have a shorter focal depth. So what I mean by that is, similarly to an ENT operating microscope, as you're going deeper in the ear, removing earwax or performing a procedure, you have to constantly adjust focus, and that's just because of the magnification. If you put your hand right in front of your face, so i.e. your hand is magnified, you'll see things right out of focus, and the further away you bring it, it'll slowly come in focus. So we're having to manually adjust the focus, although with the WAXscope we can do that with autofocus. You just double tap the screen, but you can also there's a manual slider there So I'll just zoom back out. It's going to have a final look at the eardrum. There is some debris left, but you're not going to get every little aspect, but we can see the whole eardrum now. So I'm really pleased with that. And then we're going to move on to this patient's right, and similarly they've got all this mushy debris against the eardrums. Again, you can see those bubbles, the floor of the ear canal. So I'm just trying to lift it, and again it's difficult because the skin plug, it's almost camouflaged because the chromopores have been killed by the hydrogen peroxide, so it resembles almost the same colour as the canal wall. And again, having magnification, it helps you to differentiate between the canal wall and keratin plug. So there's just some skin here to the back part of the ear canal. And believe it or not, this bit here now that was directly off the eardrum, but it looks really magnified, obviously, because it's using the WAXscope. So yeah, so this is actually on the drum, and it just makes it much easier to remove. So again, it's just on the posterior quadrant of the eardrum. Just going to delicately remove this, and there is a little bit left on the superior aspect. So again, I'm going to zoom in a moment and remove that. There's going to be some residual debris, and there's no avoiding that really. But I can't really see the hammer bone, it's kind of hidden away, so we just want to reveal the short process, which is the top part of the hammer bone. So again, I've just zoomed in, just going to adjust the focus. I'm just going to kiss the surface and see I've got some debris away, and I'm happy with that. So I can see the short process there. So if you're a clinical ear care specialist and you are interested in either the WAXscope or the endoscope, the clearscope, please do email info@clearwax.co.uk. So I'm just mopping up some softened, macerated skin that's on the floor of the ear canal. And if you wait till the end, it's just a little hair strand there, that's why I've come out. I was going to push this hair out the way using the specular. It's just kind of slightly obscuring the view. If you stay to the end, I've got some images of that skin plug from the left ear. I've got 3 different angles. I know some you enjoy looking at these still images. Sometimes it's just not possible, or I forget during clinic because I'm just so busy, and it's going to prep for the next patient. But I got a bit of time to take the pictures for this one, so I thought I'll share that with you guys. So this ear just needs to dry up now because of all the drops they've been using. Just having a good final nosy around. And that's that keratin plug from the left ear, which came out in a single, more or less of a single piece. So it's just this different angulations of it. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.